Sorry, running a few minutes over today. I do apologize. Thank you for everybody for waiting. I think we have everybody joining in. I think Jessica's the last. I got a lot of J names today. Sure, everybody able to hear me okay? Yeah, Julia, you can. Good. Julia, I'm going to be using your account for training today. So if you're in it, can you log out for me, please? Because otherwise we're going to get errors, and we don't want that to happen. So we got Julia.
I
We
don't think
got
I'm in.
Julia. Do what would you say?
I don't think I'm in it right now.
Okay, that's fine. We got Jessica, Julia, Jenny. We got a lot of J's today. All right. And then Orabosa. All right, let's go ahead and get started. I apologize for running a few minutes over. I feel like I'm running to the finish line every day, so I do apologize for that. These meetings I used to do one-on-one. My schedule just does not allow one-on-ones anymore. There's just not a time in my day. So that's why we're doing this group training, okay? Every single one of you are going to get a copy of this. My assistant will send it out to you guys. So I know that I talk fast and listening me, you've already hopefully listened to the other videos and you know that I ramble and go on and on. So hopefully you got something from that and you're already able to watch that because it gives you a basis of what we're going to go over today. Some of it may be a little bit repetitive. There's been some changes since I recorded those videos almost 3 years ago, 2.5, 3 years ago. So there's been some changes. You probably have noticed those changes in your system if you've gone into your system and played around, but you're going to get this. And then there should be, I'm going to have some videos that are going to be launched probably in the next, I don't know, month or so that should get out. You guys will all have access to those too, that you can go and kind of keep learning and stuff there. You are not going to know everything. I mean, when we get done today, you're going to be able to put patients in and that kind of thing. There's still going to be some stuff that you don't know or that you forgot, or maybe you glazed over when I was going over the things. But you will still have those moments you're like, oh, I don't remember. So I'm going to show you where to get to support and stuff too, how to get PracticeQ support, how to get our support. We never want anybody to leave the setup thinking that we just shoved you out on the life preserver and said, bye, good luck, don't ever talk to us again. We're still here in case you need help or somewhere down the line you want to change something or whatever, need to reach back out. We're still available for that. And then PracticeQ is very helpful too. They have a lot of support articles. If you have not found those yet, I'll show you where to find those. But we're just going to kind of go through the system. It does take a little over sometimes an hour and a half. You're welcome to drop off if you need to because this is going to be recorded. You'll get the whole thing. If you need to drop off at any time because just something else happens, I know it's later in the day for some of you folks. So if you need to log off for kids or whatever, that's fine. Again, you're going to get the video. If at the end of the video you feel like, gosh, I really still need a couple of questions answered, I'll stay on later and answer questions. I don't have a problem with that. But if you can't do that, then just reach out to me and I'll send you a link for like a little 15-minute appointment, little question answer type of session if you need that. If you don't need that, perfectly fine. You're ready to go. So each and every one of you should have gotten an email that said, hey, dreams come true. We're finished with your PracticeQ account. Did everybody get that email? Yes? Anybody didn't get it? Okay. If you didn't get it, reach out to me, let me know, and I'll send it to you. It has all of our links in there, like if you need help moving forward for marketing, if you need help with your front desk, you don't know what to do as a front office person, we have someone that can offer training for that. If you need to get a hold of us for, for PracticeQ support, how to reach out to us for that. If you need to reach out to PracticeQ, how to do that. How to delete a pet test patient out of your system. All of that's covered in that email. I do want you to go in and play with your system. Every single one of you should create, I don't care how many patients, but you're going to go in there and you're going to act like the patient, go through your website, try to book an appointment that way, go on the back side, try to book an appointment that way, go in as the patient from your personal email, fill out all the forms, read everything, sign everything, and then go in as the provider and then start a note, right? Bring every single note in there, play with them, touch everything, all the consent forms, look at all of those. You should have already reviewed those in the setup, but you may need a refresher because I know when you're setting up your private practice, we're coming at you like a bunch of little hungry sharks, a lot of information, you may not remember what's in there. So just make sure that you go in and you're familiar with everything, where everything is, and then flip the switch and start seeing patients. If you already have patients in your system, going to kind of be a little trial by fire type of thing. But everything should be working the way that it should, that it's intended to. Crystal does a QC on every single one of these accounts before you get to me. So if you find something, it's going to be surprising because she's pretty meticulous when it comes to that kind of stuff and making sure everything's working. But you do have the next 30 days to find, those spell check tiny little, error. Hey, this question's not working correctly, whatever. So the next 30 days is your time to play with it. after that time, or even during that time, if you say, you know what, can I add this form in, or can we do something else here? Circle back to us and we'll see if we can do it for you, or if that could be a charge possibly, or if we can send you to a support article where you can do it yourself. I'm not even opposed sometimes to do little videos and go, hey, this is how you do that here, right? Just to be fair to you. So definitely use it to where you're feeling comfortable. That's the only way that you're going to get 100% comfortable in your system. There's nothing worse, because I've been that agency nurse that gets, you go to a hospital, first time you've ever touched the system, and now you're seeing a patient, and you're like, oh my gosh, I don't even know what I'm doing here. So the more you play with this, the better you're going to feel. Okay. So let's go ahead and get started. Let me share my screen with you guys. Can everybody see my screen okay? Okay. And I'm looking at my screen and going through stuff. So if you're waving your hand or anything like that, I'm probably not going to see you. So if you need to butt in, just butt in. But try to save the questions kind of toward the end, because chances are I'm probably going to cover it. Unless we move on to something and you're like, wait, can you whatever backwards there? But chances are I'm going to cover all your questions in time. If we stop with a lot of questions, then it really prolongs the time. And some of you guys on the East Coast will be like, gosh, I'm ready to get off here. So I'm going to back up here on this page. All of you guys will default to this page when you log in. This is your booking calendar. You can do everything you want to do on this side of the calendar. Patients can't book where the gray areas are, but you can. You have complete control over your calendar on this side. But something that IntakeQ added in since I did those videos was a dashboard. So you can back up to the dashboard. If you like this view better, you can also default your login view to your dashboard and not your calendar. We've just found that most people like their calendar. So if you back up to this view though, IntakeQ is always adding more things onto their dashboard. So they put these 4 things in here. You can take them out if you don't want them, but you can edit your dashboard here. So if you click on it and you click on the dashboard library, you're going to see all kinds of stuff in here. Like all kinds of stuff, potential card issues, your e-prescribe queue. This is one that just came out like a couple days ago. I haven't even looked at this one. So when people go in and put a thing on your refill, supposedly like your refill list, you can refill directly from this little dashboard here, which is pretty cool. Which brings me to my next point. IntakeQ is constantly doing stuff in here, constantly. So anytime you get an email from them, don't just dismiss it. See what it is. See if it applies to your practice or if it's something you've been waiting on. I'm going to go over the request a feature area too, but if there's enough people that request something to come across it in your system. So if you decide to add these dashboards on, you just go into your dashboard library, you click add to dashboard. You can rearrange things. If they have anywhere in the system, you see these little flowery looking wheel things, that means there's other settings in there. So play around with this. You don't have to use it if you don't want to, but there may be some things that you want to keep front and center. Once you get your dashboard library the way that you want, you just click Save Dashboard, and then you're done. So that is the dashboard. You can also get to sending a forms, scheduling appointments, and everything from here. You can also do that on your booking calendar here. So add appointment, that kind of thing. All right, so then we're going to back up to forms. We're going to start there. Well, not start, but the next section we're going to go over is forms. So each one of your systems may look a little bit different depending on which forms you might have added on. All of you have the standard forms, which is, I don't know, something like 70, 60 something forms that come into your system. And then you had the option to purchase others. So this one may look a little different than yours if you have a different kind of form, but you all have the main intake form and note template, because you're all psych, right? Anybody not psych? Everybody psych? Okay. So you all have this patient intake form and consent and this note template here. If you don't hear anything else I say, this whole meeting, this is very important, so pay attention. These 2 forms are married together, or you'll hear the term pinned together, okay? So everything that happens in your intake form that the patient's filling out for you, all that information is going to flow over to your note template, because we have created all the little things in the background to make that happen. And those things are called rules. Those rules make all the groovy cool stuff happen in your note template. So if you come into the patient intake form, when I talk about rules, click on it. Rules. These are the rules that I'm talking about. There's a lot of them. and some of them do multiple things in the same rule, okay? So rules do things like pop in consent forms based on an answer to a question. So for an example, if the patient says they have Medicare, then a form consent to bill Medicare pops in. If they say they don't want to use their insurance, a form for patient election for self-pay services pops in, just based on the patient's answer to a question. That's a rule that makes that happen. If they say they found you through Alma or Grow or Headway, it'll put a tag on the patient's chart letting you know that. And we put in about, I think, 10 different tags at this point. If they have secondary insurance, a tag gets put in. Medicare, Medicaid, all these things will pop into the system automatically. The other thing rules do is they hide and show questions based on answers to a previous question. So when the patient says, I have allergies to medicine, puts in another question, well, what are your allergies? If they said no, they'd never see that second question. The third example of a rule. The fourth example of a rule are processes. And we've created a bunch of processes that I'll go through later, but they're over here. And those processes will do other things in the system. So if you come in here, long story short, if you come in here and you start rearranging stuff, pulling questions out, doing a bunch of changes, you could potentially break these forms, okay? And it's a lot. If you don't know how rules work, and if you want to learn, I'm happy to teach you. But if you don't understand how the rules work and can't come in here and find it and make it work with what the changes that you're making, please reach out to us. I would rather you reach out to us and ask us to pull something out if we can, or hey, what is it going to take to redo something or whatever. I'd rather you do that than come in and just totally obliterate either your note or your intake form, and then you come to me and go, I totally messed it up. Can you fix it? Because I'm going to have to charge you money, and I don't want to do that. So those two forms are the only ones that are just heavily ruled like that to make it do all the cool stuff, okay? The other thing about forms, so you have three types, and I know I went over that in the previous video, but the first type is intake forms or questionnaires. These are questionnaires, or these questionnaires are things that patients would answer, like, right? So your intake forms, your screening tool, anything where you're gathering information that, from the patient side that they're filling out. Then you have your consent forms, pretty self-explanatory there. And then your note templates. These are things that you or somebody in your practice will be documenting on as far as patient information goes. Now, consent forms, I know I went over that in the video, so you can get that information from there, but I do want to go over some parts and then some extra stuff with consent forms. People get real caught up on the term consent forms. You can use this area for other things. So if you have a really cool flyer that you like to give to patients, or if you want to create a newsletter that you want to send, or some kind of special instructions or educational tools, you can upload those PDFs in here and send them out to patients. You can also upload them and put them into packages up here. So if you had a whole like little educational booklet that you want to give patients, certain patients, you could create a questionnaire and add those educational things to it. So as you're working through your system and you're thinking about different things, sometimes if you think outside the box, IntakeQ can still facilitate or make that happen. So just kind of a food for thought. These consent forms are kind of like Word documents. They have just text in here, and I know you've probably gotten in here and played with them at some point and edited some stuff, but you're going to see different types of boxes in here. And if you remove these boxes, then you're removing something the system is doing automatically for you, or maybe something that the patient has to put in or you have to put in. So the different types of boxes are mapped labels, these little green boxes. You'll see these orangey-like boxes, and then you're going to see gray boxes. And maybe on occasion, you might see radio buttons or check boxes. If you remove these mapped labels mean that something is there. The system is going to know what to put there. So if the system already knows the patient's name, it doesn't make sense to ask the patient to put the name in again, or to ask you to put the name in again. It can just put it there. So that's what mapped labels are. If you want to know what the map label is, you just click on it. What is that putting there? All right, so this form is automatically putting the patient's name in, your provider name in, and then any diagnosis they're being treated for. The green boxes are called pre-fill boxes. This means it's going to stop you before you send this consent out, and it's going to ask you to put in some information. So this happens to be the consent for mental health treatment during pregnancy. Come to you, I'm pregnant and I'm taking a medication. Like, hey, Bev, there are risks. There's a risk to any medicines, but during pregnancy, there's been some research. It does have a little resource here. Patients can click on that resource and go to that website. But you are able to put in the current pregnancy, gestation, their EDC if you have that, and then what medication you're taking. When you send this to the patient, now these boxes will be grayed out. They won't be able to change those, but their boxes are going to pop up for them to initial and then sign down below. The orange boxes mean these are required. The patients are not going to be able to get through this form without initialing and signing their consent form. You can also send these to patients when you're in the visit with them. It doesn't hurt anything to send them a consent form while you're sitting there talking. Actually, it's preferred because we all know how good patients are at signing consent forms after the fact. So get them to send it, to do it and complete it and send it right back. It comes right back into their system. The other boxes you'll see are these gray boxes. Just means they're there for some kind of information to be entered in, but they're not required because they're not yellow, that yellow-orange color. So those are your parts and pieces of your consent form. This form has, this toolbar is almost in every single area where you can manipulate things like your emails, that kind of stuff. It's a pretty easy toolbar. You hover over, it tells you exactly what that is. So it's easy to make those changes, whatever that is. And then your fields, these fields I was just talking to you about, live here. So I encourage you to play with these. These forms aren't terribly hard to build unless you do the rule things, but there is some little nuances here and there. But once you play around with them, you kind of get the knack of it. And if you really want to get nerdy and really want to explore how to do these, reach out to me. We can have a training session. But don't make changes to your originals, okay? So if you come in here and you're like, oh, I really want to play around with this intake form. Let me see what I can do. Let me play with it. Duplicate it, right? Make a duplicate. Call it something test form or whatever so that you can play with it. Don't make changes to your original, because that way, if you mess it up or whatever, you can just delete it and be done with it, but you still have your original copy. I joke around and say I've been a nurse long enough that you had file folders when I was a nurse, right? And you get to the last note chart that you pulled out and it has original written across it in orange or yellow highlight. Anybody remember those type of things? These are your originals, okay? So you don't want to mess with your originals. You want to keep those here and play with a test one if you want to mess around with it. All right, if you're using Spruce, you're going to have a Spruce communication flyer, and you guys can look at that on your own, but it basically directs people to download your Spruce app. We turn off the ability for patients to message you in the portal and IntakeQ's portal, but they can do everything else in their patient portal. And it tells them very clearly the messaging has been turned off. So you want to direct everybody into Spruce. And if you have not had your Spruce training, you need to schedule that with Megan so you can get your Spruce training done. If you don't have that link, let me know. And then in your note templates here, again, remember your note template. We're going to go deeper into your note template at the end of toward the end of the training. But this one note template works for both your initial eval, your follow-up. It works for adults and it works for children. So you don't need separate templates. It's all in one. It makes all those rules make it toggle back and forth between all of those different types of visits. Your lab order sheet, this is what you're going to send to patients through the patient portal or print out and hand to them in order for them to go get their labs done. If anybody is cash pay only, then you have the option of using Rupa Labs. But if you're not cash pay only, Rupa Labs is only for cash. They won't take insurances. IntakeQ is working on some integration with labs like Quest and LabCorp. However, you have to understand that it's on the lab's side to connect with you. If you don't send the lab enough volume, they're not going to connect with you. It doesn't matter if your system has the ability to do it or not. They're just not going to connect. So you can still use this lab order sheet, give it to the patient, send it to them, patient portal, print it, whatever. The lab will take that sheet and then they'll fax you the results and you upload them into your system. If you're not using IntakeQ's fax, you're using Spruce, then you would just upload them into your system. The other stuff here, pretty self-explanatory. Insurance verification for those of you using insurance, whomever, if it's you or who are your front desk or whatever, can use this form to make sure they're asking the insurance company all the questions they need to ask, because you should be calling on all new patients. After that, you can just check and make sure the insurance is still valid online. But for the first visit, you want to call, because sometimes insurances have like small little sub plans or whatever, and you may think you're in network with that insurance, and then you call and you find out you're not. And that gives you the chance to stop then and tell the patient. Patients may have a big deductible. It allows you to tell the patient they still haven't met their deductible. And it also gives you a name and reference number for whomever you talk to. So if that claim comes back at some point, gets kicked back for some reason, you can say, I talked to Mary, reference number XYZPDQ, and they'll be able to look it up and see that you actually had that conversation. So it kind of helps you in that area as well. You do have your termination letter. So if you get ready to discharge a patient from your practice or terminate them, you fill it out like a note template send it to them. You can share it to the patient portal, also print it out and mail it if you need to do that. Every time a patient requests medical records, I don't know if you know this or not, but if they request medical records, anybody requests medical records, you have to document that you release medical records to and who. So that's what this note template is. You have a blank letterhead, you got a blank progress note. So if you need to write that patient a letter, you can just type it out there. Again, send it to the patient portal or print it out. I recommend you send everything to the patient portal just because that way they can't come back and say, I lost my lab sheet or I lost my school excuse. No, you didn't. Still in your patient portal. You can go print it out there. Save you some time and some headaches there. The other thing on forms, IntakeQ is developing forms as we go along. So you'll be able to find some standard forms here. They may or may not be useful to you. Just check them out and see. The other thing you'll find is if you join that IntakeQ community on Facebook, they moderate that Facebook group and they'll answer questions. I'm in there. I'll answer questions. Your colleagues are in there. You might see each other in there at some point. But it's a really good place. People share stuff in there, forms that they've created. So you can get those forms and pull them in and look at them and see if you want to adopt them. I do encourage you, though, if you pull a form in here and you don't like it, just delete it. Don't save it for a rainy day or whatever. Just get rid of it because you already have a lot of forms in here. And when you go to drop down the list to find your note template or, intake form or whatever, it's going to get long. And if you just have a bunch of willy-nilly forms hanging out in there, it just clutters things up. So get rid of it. Test that before you put it into play, right? Look at it from the provider side, look at it from the patient side, because sometimes people are nice and they create stuff, but it doesn't look all that great or it doesn't function the way that it needs to. So just keep that in mind. The other thing is you do have the ability to share forms. So my forms, even though you bought and paid for them and put them in here, I spent a lot of time working on these forms. And that's what keeps my lights on, right? So I ask you just kind of, please don't share my forms. I don't want to have to go back and work in the emergency room at this time in my life. At 51, that sounds like a fate worse than death to go work in an emergency room. So please don't share my forms. You also have the ability to back up or go back to a backup of a previous version of a form. So if you forget and you don't make that duplicate and now you've messed something up, you can revert back to a previous version of it. So when I click on backups, it'll show you the different versions of the form and when it was put in your system. Now it does consistently back up as you're changing stuff in the form. So if you're changing and saving as you go along and you haven't exited out of that form, it's like a snapshot, I guess you could say, in time. So if you make a few changes and then you get out and you come back and you make a few more changes, it snapshots it at different times. So it's not always like every 30 minutes are you going to get a different form. That's what I'm saying. And if you do revert back or restore is what they call it to a previous form, what the system does is it brings you back all right, but it puts a restore underneath that name and it still keeps the one that you made the changes to as the original. So you'll have to do some finagling in there to fix it. And if that happens to you, just reach out to us. We can tell you real quick how to fix it. I'll probably have a video on it. But if that form's connected somewhere else, then you'll have to unconnect the one that you messed up and reconnect the one that you restored. So it's a little bit of a process, not terribly hard, but just know that it's not the end of the world if you accidentally mess something up. There is an ability to back or to restore it back up. All right, the booking settings. Before I get that far, let's go over these little things up here. This little looking glass, you can find patients, you can search patients there. This little guy here is notifications. Now with the notifications, you see that there's only just a few. It doesn't keep a long list where you just scroll and scroll. It's the most recent things. So it's not always inclusive of all the different notifications. Now they do have their product updates that does stay pinned here so that you can see any product updates that are happening. The next one here is your task list. So there are different tasks that we have created for you on your processes area. And I'm going to go through those in a second, but this is where they're going to pop up at. This is your patient portal. So there's settings and stuff in here in your patient portal that we're going to go in and look at in a minute too. Bookings. So this is the biggest area. This booking settings area is the biggest area of this whole system. And this is where all of the, pretty much all of where the settings live that control your online booking settings. Like when somebody goes to try to book with you online, all of those settings live in here. And it's quite a lot. And I know I've gone over some of them in the training video, but there are still some things I like to point out when I do these videos that you remember. IntakeQ was built by software engineers. There's not one clinical person on their staff over there. So when you call them about something or you reach out to them with support, you have to think that these people aren't clinical. Okay, they are IT people and they can walk you through IT issues. But if you try to go to them with a clinical issue, they may or may not be able to work you through that. And that's kind of where I guess my company can come in, because I have both the clinical knowledge and the IT knowledge to be able to kind of translate between the two. But just kind of keep that in mind when you're talking to people at IntakeQ, is that they just clinically just are not there. And God love them, they try really hard sometimes, but just not there. Um, I talked to actually the general manager over at IntakeQ, and we've had long conversations about different things. And he said, talking about the price of IntakeQ, and it's pretty reasonable compared to some of the other stuff out there, especially with all the automations that you can do. He says, if I bring on 10 Beverlys with the nurse background, the clinical informatics stuff, I have to pay each one of those nurses a lot of money. And I can't absorb that money as a company. I have to pass it on to the consumer. And then people are going to complain that, it's too expensive now. But now I have to have nurses that will onboard every single specialty that comes to IntakeQ. So it can get very costly. The same thing happens when people say that there's no number that I can call to get a hold of them. It's costly to have a call center on call 24 hours a day. That cost has to go somewhere. The same thing with outsourcing different, the integrations that we're going to go over and more. They integrate with those clearinghouses. I know they're working on getting their own, but they try to pull in all those different software systems in an effort to save you some money, because they're not owning those software systems inside of their own thing, if that makes sense. So just clinical IT stuff. And if you have IT issues, right? Like one day you get on and your IntakeQ is not loading, or it's slow, or something's happening technical wise, IntakeQ, PracticeQ, your people. I can't get into their servers and look at that kind of stuff. There's nothing I can do to fix that. If it's something with our forms that we created or the processes that we created in here for you, reach out to us. We'll see if we can help you. Okay. So I just like to make that designation there between the two, because it is vastly different sometimes. In your booking settings here, I don't care how many providers you have in your office. If you're the main administrator on this account, this is always going to be your schedule. Okay. Now your schedule can fluctuate a little bit. You can block times and do all that kind of stuff, fancy stuff with your schedule, but this is still going to be your hours of operation. Every individual provider that's added into your system will have their own schedules that they can adjust, or you can adjust as the admin. So keep that in mind when you're opening, closing, and trying to facilitate hours and all that kind of stuff here, that this is always going to be yours. The other thing that I see that providers will try to do in here is they'll come in and they'll create 500 different locations. You don't need different locations. You don't need a different location for telehealth, because we've taken care of that in your service types. We'll go over service types in a minute. You don't need a location for different classes that you teach, service type. You don't need a location for gift cards. I've seen providers that come to me with, like, I think the longest one was 25 different locations. She was wondering why her schedule was crazy. I was like, because you've got 25 locations and you got another 45 different services in here. Like, only imagine how confused her patients were when they were trying to pick something to book with her. So if you feel like you are having to come in and add all these extra things, reach out to us and we'll see if there's a better way to streamline things a little bit for you, instead of having all of that stuff in there. If you do physical locations, then you have your address here. If you are strictly telehealth, then you would put telehealth online visits, or whatever you want to call here, on your address. People do it both ways. There's not a wrong or a right way there. It just depends on how you want it. You don't need to worry about alternative hours. Okay, this is only if you're a solo provider and you are offering maybe morning hours on some days and afternoon hours, but you got a big gap there in the middle that you're not going to be open. If you just have a lunch break, you don't need alternative hours. Okay, so it's just for big clumps of hours in the same day that you do these alternative hours. We've set it up for you to work with your services already. Service types. This is another place where, like the lady with 45, and I'm not joking, 45 different services. Keep this simple, okay? This is what your patients are going to be seeing online when they try to book an appointment with you. If you have 500 service types in here, it's going to get confusing for them, for you, for your biller, for your front office person. Simple. So we've put online initial eval and office initial eval, online follow-up and office follow-up with med management. She's got a little bit different here, different times. So each one of you may look slightly different, but you shouldn't have to have just a bunch of different services. Each one of these services has their own little settings that hide in here. Some of these settings will cross over these settings here in this tab. So if you come in here trying to change some settings globally, and you come to this tab here and try to change them, and it still isn't working for you, chances are there's a setting in here that's overriding it. And I'm going to go through those settings here in a second. If you find that you have a bunch of different types of appointments, you need some way to group them, you can create categories. But if you're just in office and telehealth, there's really no reason for categories unless you just wanted them to be there. If any of you guys have gone to our website and booked an appointment with us and you have all those different categories in there, that's an example of how categories look. We have a lot of different service types, and we wanted to be able to guide people into those different appointment types, right? So an example would be I worked with a PMHNP recently that was also sharing, or not sharing, well, she was sharing office space, and also had someone working with her under her that was a massage therapist, did Reiki treatments, and I think massage, Reiki, and I can't remember what else, infrared stuff or whatever. And she wanted to be able to break those up. So that makes more sense, right? Categories for massage, psychotherapy, those make more sense in categories. Just basic med management doesn't really make sense to have categories. Packages are for people that want to do like those, you have the providers that want to break things up and have people make monthly payments and do some kind of plan type of thing. Or if you're wanting to offer so many visits, if you purchase a group of visits with me for X amount of dollars, you can do that in packages. That's usually outside the norm, but if it's something that you ever decide to try to start implementing in your practice, we can definitely help you set that. Coupons, those are okay, but I tell people in your practice, you're not going to be offering coupons, right? Normally you don't do that. You might want to offer a coupon to somebody if they refer somebody to you or whatever that they want to pay for something else with, not their insurance co-pays, but maybe their cash pay or something like that, but have a policy in place. But most of you aren't going to be using coupons. If you're selling services, maybe you're doing some supplements or something like that in your office, selling a product of some sort, then maybe a coupon might make sense for you. Price schedules are, I've had some providers that are carrying patients over from another practice that they're coming from. They're not credentialed yet. Maybe they want to offer those patients a different price for their services. That's where price schedules could come into play. Don't discount your services though too much, right? So, because what will happen inevitably is if you cut your service price too much and then you get credentialed with insurances, those patients that have been paying that lower price may have to now pay more because you're taking their insurance, and they're going to get upset because, wait, I was paying you $100 before and now you're telling me I owe you $250 because that's your visit price. You have to collect from that patient what you are contracted to collect from them, and unfortunately sometimes that is more than what your cash pay price would be. And you can't persuade patients to try to pay cash. If they ask you like, hey, what if I don't use my insurance, can I do that? Yes, they have the ability to do that, but they have to sign. You've got a consent. Every single one of you have a consent in here that's a patient election for self-pay service. You have to make sure they sign that because that covers you. Because what will happen too is patients will take all those little invoices, right, and try to turn those into their insurance company to get some money back. And then the insurance company is going to go, hey, Julia, why'd you charge these patients cash? You take our insurance. And you have to answer to that, right? You can get in trouble. So make sure if you're doing these special prices for people, you need to have a policy on how people qualify for a sliding scale, that kind of thing, who's reviewing that. There's a bunch of stuff that needs to be put into play. Don't just willy-nilly give people discounts for various different things because that can open up a whole nother can of worms. So just be careful with this whole price schedule thing. All right, let's go into the individual appointments. I'm not going to go into every single one. I'm just going to go into one, and we're going to go into the initial online eval. This information is what your patients see online. Some providers want to hide the price or the price of the visit. Other providers want to hide the duration of the visit. You can hide both if you want to. There's different thoughts on this. There's no right or wrong. It just depends on what you want to do with your service. And you can hide services altogether in another area. But these two things, like some providers say, I don't want to scare people away if they see this price, if they have insurance. Valid. But also, you might want to let people know that this is my top end price if you're not covered by insurance. Two thoughts. The other thing with session, right? Some people want to know that my new eval is going to be 60 minutes long. But then you have some people on those follow-ups saying, your follow-up visit is 30 minutes and we're at 22 minutes. So there's those thoughts on either end of that. As you add in more providers, these settings are going to change. You're going to see providers pop in here. You've got to attach providers to services. There's a lot more that goes into adding a provider into your system than just adding them as a team member over here. They have to be connected to things. Their account has to be set up. There's more than just turning them on as a provider. So if any time you decide to add a provider on, reach out to us. We can help you with that or guide you to where you can possibly figure that out, how to do it on your own. Coming on through to the next one, the form. This is where we have connected your intake form with all its consent forms to go out to your patient the moment you say, yes, I'm going to take this patient, or if you schedule them on the backside for your own. This is where that form lives there. If at some point you change that form, you decide not to use ours, you want to do something different, you're going to have to reconnect that new form here. These other settings, so IntakeQ's gotten better about putting little black box little thing hovers over it so you can figure out what this is on each one of these. This one, you don't want to enable this because you don't want the patient to get this form every time they book an appointment. They may book a new patient appointment with you accidentally. Some patients will do that if they can't find a follow-up appointment with you. They'll go ahead and book a new one. Can't stop them from doing that unless you have a little talk with them. But if they do that, they were going to get this form and stuff again for them to fill out. You don't want that to happen. And then send the form before the appointment is confirmed. There's pros and cons to this, okay? There's different ways in IntakeQ that you can do different things. And unless we set you up way different in the initial setup, we set you all up the same. That's where patients go online, they click to book an appointment with you, they're stopped with that screening tool asking all the questions, then they have to put the credit card information in, and then you say yes or no to the appointment, and then their paperwork goes to them. There's multiple ways to do that. Some providers say, I don't want to use the screening tool, I want to use a form, and then I have to say yes, and then I'm going to send them a link. There's just different ways to do that, okay? So that is where this comes into play. Some people want to send the intake form and consents first before they ever book an appointment. Good theory, but you have to think through the other part of that. As a patient, if I get that intake form and fill that out and sign all those consents, and then you say, no, we're not a good fit, I'm going to be a little aggravated that I went through all that time and filled all that stuff out. So be thinking about those processes as you're moving into your private practice. And if you feel like the one that we set up for you isn't working, then let's talk to see if there's something else that you might want to do differently. That's a pro and a con of IntakeQ, that there's so many variations to do different things. And if you don't necessarily understand how the system works or haven't utilized it, then you don't really have a good concept of that. And we don't want to set you up in a way that you're not sure and then you want to change things later. The way we've set you all up is the 95% of the way providers get set up. So they book online and get the form sent to them after you say yes to the appointment. So just thinking about that. Overrides. So this is where I was talking about this. Okay, so you have those settings in here that cross. Wherever it says use account default, that's where it's defaulting to that other tab. So coming in here, there are some things though you don't want to change, and I'm going to tell you why. This first one, for new patients, if you're using that screening tool option, you don't want to change this to never, other than never confirm automatically, because you want the ability to say yes or no to that patient. If you say, I don't care, I don't want to use the screening tool, anybody can book, I'll take anybody, then you could change this to something else. But if you're wanting to use a screening tool, keep this on never confirm automatically for your new patients. For your follow-up patients, you want to say auto confirm. That means you don't have to look at anything. They're just going to book on your schedule. It's going to be okay. Everything's fine. Now, what will happen sometimes, a patient will try to book a follow-up appointment with you, and they don't go through their portal. They go through your website, and they create themselves a different name. They were Mary Jane Smith before, now they're MJ Smith. Okay, if you think about it like that. The system's going to say, we don't know who this patient is. Can't match it with another patient. So it's going to pop up kind of like an unknown patient, and I'll show you how to take care of that in a minute. But those are the only two that you want to use. The next one is widget. Right. They call their online calendar a widget. I don't know why, but that's what it's called. Online calendar is a widget. When you have more than one provider, you can pick on how the system works with each appointment type. So for new patients, you have different options on how you want the patient to be able to book with you or with the providers in your practice. So you can always change that. Lead time, we usually come in here and set you all up for the same amount of lead time. You can get special in here and come in here and really on each one of your appointment types, really dig down into how much time do you want this patient to be able to schedule with you online. Remember, you are under complete control under your own schedule. So if they call you, you can schedule them tomorrow. But if they're booking online with you, this is going to make them book so far out. I do recommend you have some kind of policy there that you are making sure that everybody is following for your appointments. So follow-ups like a day or two, right? Even on my schedule, I want to know what I'm doing tomorrow the night before. So I don't let anybody schedule with me the next day just because I've already planned to either go to the grocery store, maybe a dental appointment or whatever with my next day appointment. New patients, you need to give yourself enough time. And that time includes a lot of stuff. So you want them to be able to fill out their paperwork. You may have to shake them down for their paperwork because we know how good patients are at getting the paperwork done. If they don't finish their paperwork, you want to have enough time to move someone else up on your schedule if you need to, because at some point your schedule is going to be like open spots are going to be like prime real estate, right? If you got an open spot there, you're not making any money on that spot. So you want to be able to pull somebody else up to keep your spots full. So if you get yourself too close of a narrow window there, you won't have time to do all those things. Oh, check insurance. I don't know if I said that or not. You got to have to be able to check insurance. If they have a high deductible, you want to be able to call them and tell them that. May need to reschedule or something if they can't afford that. So I don't recommend anything closer than 4 days. 4 days is still pretty tight. At my boyfriend's practice, we have a 72-hour window but we have two front office people. The front office person, the main one, is looking to see if people have done their paperwork. And at that 72-hour mark, that second person comes in because she's checking insurances. And if they haven't got their paperwork, the patient gets one notice on that same day and says, hey, if your paperwork's not done by 5 o'clock today, unfortunately, we're going to have to reschedule your appointment. And the patient will either do it or they won't. And at 5:15, if they're not done, she's canceling their appointment and she's moving a person up into that schedule. So develop something like that in your practice where you consistently are doing that and things will run a lot smoother. If you wait to the last minute, you'll feel like you're chasing your tail. Did they do the paperwork? Did they not do the paperwork? Little side note, if they didn't do their paperwork in their intake form, your note template is going to be blank. There's nothing going to be in there. And then you're going to have to fill out all those check boxes and drop downs, and nobody wants to do that. So make the patient take the time on their end to fill that stuff out. They can sit on their couch at home and fill all that stuff out, and it just comes over into your note. So don't be afraid to reschedule folks. Very important. The same day across from that is only if you allow lead time as the same day. Most of you, none of you are probably going to do that. You can, if someone's having crisis, they can call you and you can book them same day. Don't let your patients online book same day. On your new patients, you always want to require a credit card. If you don't require it, they will not put it in. And then if they don't show up for their appointment, you don't have a way to charge their credit card unless they fill their paperwork out and all that kind of stuff. Then you have a credit card on file. But this just lets them know, hey, you don't show up for your appointment or you late cancel, I'm going to hit your card. So make them put a card in. If they don't have a credit card, so you have those situations sometimes where a patient, we had one that just got out of prison. He was like, I literally just got out of prison last week. I don't have a bank account at all. But my mom's going to put her card on file for me. Can I do that? Yes, you can do that. But there's on your paperwork and stuff, and we'll go through that in a second, there's going to be a box. They can't get through their paperwork without that credit card consent. So there's a couple of different instances there where that credit card can be a problem. But if you don't require it, they won't put it in. On your follow-up appointments, we don't ask them because they've already given you a card. You don't need to ask them again unless something changed, right? Their card, usually they'll give you an updated card or their card won't go through, but there's no reason in stopping them to ask them for a card again when they book that appointment. Is anybody cash pay only? Okay,
I
Jessica, you are?
currently, I'm waiting on all my credentialing.
But you're not just solo cash pay, never going to take insurance. That's what I'm
No,
asking.
no.
Jessica, are you solo cash pay? Okay, so I'll go over this for you. So cash pay changes things a little bit. You can come here and set your settings for your appointments differently per appointment type again. So if it's a new patient, you can require them to put a credit card, or not credit card, require a deposit on that account. So if you click require deposit, it'll ask you how much of a deposit you want to put in. You can also, if you don't ask for a deposit, you can charge their card automatically when they book, or you can charge them on the day of the appointment. So there's a little bit of a tweak in a setting that you can do there, and you can do that for new patients or follow-ups, depending on what you want to do. For those of you that take insurance or that are going to take insurance, keep this global setting as don't charge client automatically. We can do it, we can override that at the patient level. And the reason why I say that is because it sounds real easy to come here and be like, oh, just charge everybody on the day of the appointment. Well, if you haven't gone in and put the patient's copay in there or their co-insurance in there or changed anything, their Medicaid, maybe they don't have a co-insurance or copay, then it's going to hit their card on file for the full amount of your visit. And then you're going to have some mad patients. So, because it takes like 7 days sometimes to reverse a charge on a card, and that could be somebody's grocery money, right? So just make sure that you're paying attention here and don't change that setting. Your advanced, so Crystal has her favorite colors she likes to put in here, but you can change your colors to whatever you want, whatever makes sense to you. We have limited some of you to your session daily limit on this appointment type. So Julia has said she doesn't want any more than 4 new patient evaluations of this type on any given day. You can change that here to no limit or whatever, but most of you probably gave that feedback at some point. You can hide this service. So if it's something that you don't want patients to be able to book online with you, you can hide the service altogether. You'll still see it. The patient just won't be able to book online. If you're not starting your practice for a while, like maybe another month or so, you can come in here and actually put the date that you want your schedule to open. So when a patient finds you or you send somebody to your website, right, they go to book an appointment, they won't see anything open or available until the date you told it to start. Right now, if you don't have a date there, your schedule is live. So the moment they find you, they can book an appointment with you. Auto tagging. So this actually came as a result of one of my clients, actually. This client had 2 types of patient populations, and he wanted to know what type of patient it was that where they found him and what type they were. And he's really big into the LGBTQ community, so he had a website specifically for them called Queer Ear. And then he had another one, Nothing Better Health, that was just general psych. He said they can find me in both places, but he had 2 separate websites and wanted to be able to know where they came from when they booked this new patient appointment. So we had different appointment types, and it automatically put a tag on the patient's chart based on where that patient came from. So the moment that patient booked through Queer Ear, it got a QE tag on the chart. If they booked through Nothing Better Health, they got an NBH on the chart. So it was very easy for him to see when he opened that chart where that patient came from. So that's what auto tagging is. 99% of you guys aren't going to use that, but that's what it is. Your Zoom meeting or telehealth, use IntakeQ's telehealth or Google Meets, will be attached to your online services only. They don't get attached to your in-office ones because there's no reason to have it there. If you have to change an in-office to a telehealth, you got to change the appointment type, and then they get a link. With your telehealth, if you have picked one and then later decide to change, it's not as easy as just going and connecting Zoom or whatever to your telehealth. There's a bunch of little touch points that it has to be changed in. And that's another thing that IntakeQ doesn't do a good job on, is telling you where all those touch points are. So you have to change it in your appointment type. You have to integrate the service to wherever that is, turn it on if it's IntakeQ's. You have to change your email messages. If you have any kind of text messages that are going out, those will have to be changed too. So there's a bunch of little parts and pieces there that might have to be manipulated. If you disable it here, it's disconnected. Now there's no link. There's nothing that's going to go out to patients or anything like that. So just be careful. Don't disable unless you're going to go through the whole process of totally connecting that other system. If you change a password on your Zoom or a password on your Google account where your Google Meets is linked up, you're going to have to come in here and reconnect, because it doesn't automatically know. It's going to try to connect using that same username and password. If it doesn't work, it's not going to connect. So if you have a problem with connection at any point, think about that. Did you change my password? If you have a Zoom link, if you're using Zoom, that is what we call a static link. It never changes. If you went in and did your little personal waiting room settings that we sent you, then patients will come in just like you did tonight. You're waiting in my personal waiting room, right, for me to let you in. Test that with people that are, when you're testing your system, test it with your family member or friend or whatever to make sure that they're going to go into your waiting room and not just pop into the screen. If they pop into your screen, then your settings aren't set up correctly. Okay, so just make sure you test that first. Embarrassing, also a HIPAA violation if that happens. So test that. If you have Google Meets or IntakeQ's telehealth, those are not a static link. That means that every single appointment is going to have a different link every single time. So you're going to be in and out of your appointments all day long. Zoom, you can stay in the same room. So with Zoom too, if you have a website, You can put your Zoom link on your website for those patients that freak out because they can't find the link. Just like on my website, it's always that one there. For your other folks that are doing IntakeQ's telehealth or Google Meets, they will get a link in their portal every time, and they're also going to get an email link to that visit every single time. Okay. Cancellation. So in here, you have the ability to write a cancellation policy for every single service. It's not necessary. We just put a general one in and it works. But if you ever felt the need to have one for each individual appointment, you could come in here and do it. You don't need it. Your CPT codes, this is where your place of service comes into play, and all your CPT codes that are going to go over to billing based on this appointment type that you're going to link to your note. And I'll show you how to link a note in a little bit. But when you link a note, your CPT codes are going to pop up to the top of your chart for you to pick which CPT code you want to use for your visit. We just put the most common ones in there. Doesn't mean that these are going to be the only ones that you're going to use. You'll have the option to pick others if you need them, but these are the ones that are just going to pop in. Now you'll notice the modifiers aren't here. It's because if you're not credentialed with insurances yet, you don't know what your modifiers are, and they can all be different. Some insurances want a GT, some insurances don't want it one at all, others want a 95, some want a 52. Can't make this easy. It's like bingo, different for everybody. So make sure that when you're getting those contracts in, your biller would know. If you're going to be doing your own billing, you'll have to find out. Sometimes insurance don't tell you either. It's real nice of them. Just go dig in for it. Internet search, Google, ask a phone a friend, but they're different. So we don't put them in here, but as you find out what they are, you can add them in. You can add more than one. It'll make it easier for your claims to have the modifiers there, but we don't know what your modifiers are going to be. So just make sure that you know that you can add them in at some point. You can refer back into the video as to where those are. Widgets. So this little link is the same as this little link. So if you have a patient that is totally lost on the website, doesn't know which appointment to book, or maybe you want to like really pigeonhole them into one appointment for them to book, you can send them that link via email or whatever. Hey, click this link and go to my booking calendar. It'll take them directly here so that they don't see all the other options. So that's what that is. If you delete it, it's gone. It's not going to come back. There's no restore on these. So don't delete the appointment unless you're for sure you want to get rid of it. If this appointment is attached to other people, like patients down the line, that's going to cause an issue because now the system doesn't know what appointment type that patient is. So just be careful if you decide just to come here and delete an appointment type. Payments. So all of your payment processors should be set up. If you're still waiting on your payment processor, and this does not say this, then make sure that you get whoever the information, Stacks or whoever, the information they need to connect your account. We can't do anything with that because that involves your personal banking information. It's a whole application process. If you've gone through the process already, you know how much kind of a pain that is. But you should be active here. Now you're ready to take credit cards. If this is not active, you can't take credit cards, and patients are going to get hung up when they try to put their credit card information in because there's the connection's not there yet. So just make sure before you start seeing patients that this does indeed say active in your account. Sometimes we get ahead. We're ahead of IntakeQ and they haven't finalized things with you yet. Just make sure that this is on. This only checks patients' accounts for the credit card, the validity of the credit card, that it is a valid credit card. It does not check to see if they have enough money to come see you, okay? Because that varies. I know mine minute to minute sometimes. So it only checks to make sure that they're giving you a valid credit card, not just putting some random numbers in there. It does a 1 cent charge and reversal very quickly that the patients usually don't even see it on their credit card. Just checks. Again, these global settings, we set them in the service types, right? And we set the cancellation policy in the service, or here instead of in the service types. If you cross time zones, then your time zone is here, and then we have enabled or disabled, sorry, here, whether or not, so it just depends on if you're, back up a minute. If you're in the same time zone that your patients are in, then this is set up with disabling time zone conversion and your time is here. If you cross time zones, sorry guys, y'all hear my dogs. I apologize if you hear them in the background. Give me just it's like having children. So if you cross time zones, then you're going to see a little box that will pop up when you're booking a patient's appointment that asks for the patient's time zone. And once you put it in there once, it doesn't ask for it again. But this allows the patients to get their reminders in their time zone but allows you to have your calendar in your time zone. Okay, so if at any point you decide to jump to another state or something like that, and now they're in a different time zone, just know that IntakeQ can accommodate that time change. Okay. These are all pretty self-explanatory. I know I go over that all in the video. Your booking widget, remember we talked about your little calendar thing. This is where those questions live that we put in those screening tool questions. Once you start looking at this, your brain's going to start kind of ticking and go, I can ask questions about any appointment type. You can, but think about it. If you're putting a screening question in here, it's going to stop the patient as they're booking the appointment. I have providers go, well, I'd like to ask about their mood. What's their mood like? Well, that's a good question, but if the patient's booking with you 2 months out, that may change. So that may not be a valid question that you might want to stop them for when they're booking the appointment. Asking if their insurance has changed might be a better one to ask. It could change too by the time they come and see you, but all of these are set up for your new patient appointments. And again, when I'm talking about little settings here and there, if you start adding more appointment types in, we've connected these questions to be to the appointment types that you currently have in your system. If you add more in and you don't come here and attach those to your little screening tool, patients aren't going to see those screening questions. So just keep that in mind. You can move these. You can just drag it and drop them here. You can remove them altogether if you want to. This is what's making it required, so the patient cannot move past that screening tool without answering all your questions. So you can come in here and look to see how they're kind of built. They're pretty easy to build out there since you have kind of a context of what would be in here. The biggest thing is just knowing that hooking this question. The other appointment reminder type this setting is for forms that you may send to the patient. Can you guys still hear me? Did I glitch for a second? Everybody can still hear me? Okay, sorry. Got a little thing that came that said internet is unstable. It shouldn't be. If it happens again, just know you're gonna get a video. So if it blips, it'll still be there. Your appointment reminders, again, just the appointment itself and any forms that are associated with that appointment. All of the other messages I'm going to show you here in a second get sent out by email. We don't create a bunch of SMS text in here because it gets kind of spammy if you're doing both. And providers, I have an iPhone. I don't know if all you guys have iPhones or Androids. It doesn't matter other than that if I swipe left on a message on my phone, it asks me if that message is junk. And it's real easy for somebody to just go junk, right? And get it off the phone. I don't care. Just get it off my phone. If you get marked as junk mail enough or like a junk text enough, then that carrier itself will block your text messages. And you don't want that to happen. So try not to put a whole lot of SMS text out there for your patients. Just kind of keep it minimal. We give usually the first reminder for the appointment is whatever your cutoff date or time is for your cancellation policy. So when you're coming in here and look at these settings, don't cut this too short because you want to give the patient enough time to cancel without a penalty, right? And then the second one is just right before their appointment. If you remind people too far out, they're still going to forget. So that's why we set those the way these are. Oh, and then here, this is what's going to go out to your patients in a text message. I don't know about y'all, but it's annoying, not ignoring, annoying. If I get a big long text, I got to scroll and scroll and scroll to read, right? So you want to keep noise. I'm like, I'm not even reading all this. I don't have time. Your patients are going to be the same way. We get, live in this little society that we do now. But anyway, keep it short and sweet. Anything you want to put here, keep it short. Don't add big long text in here. The other thing that will happen if you start adding a lot of text is you may run over your allotted amount of text message segments is what they call them for IntakeQ, and you'll start getting charged. It's not a lot. It's like a penny per so many characters or whatever, but it could add up, especially if you're sending a lot of those automated texts out. You already pay enough. You don't need all the extra stuff. So just keep this short and sweet. And you can test it, send it to yourself down here at the bottom and see like what that looks like to come over on your text. Play with it there. Sync, people either love it or hate it. You can sync your calendar with your Google Calendar. Is anyone using Headway, Alma, Grow, any of those companies? Yes, okay. So what will happen here sometimes is people think, people will think that since it came over from their Google Calendar from Alma or wherever, that it's going to automatically go it's gone in to intake queue. It hasn't. It's just seeing it on your calendar. So there is a disconnect with those companies on either end. When a patient comes and joins your practice, you are going to have to come in here and manually add them in and send the paperwork and stuff to them, right? It does help kind of as a reminder, oh, I got a patient scheduled that day. Then your intake queue appointment is right next to it, side by side. So you know you've already sent them the paperwork and stuff, but it doesn't automatically create them a chart in your system. Some people hate it. They don't want the duplicates there. You can very easily disconnect it in your system if you don't like it. If you do connect it though, don't connect the Google Meets. If you're already using Google Meets, this will already be done. But if you aren't using Google Meets and you implement this, don't connect the Google Meets because your system doesn't know which system you're using for video. Okay. And then on the back side of that ALMA headway grow thing is when you get a check from them, you now have to come into your patient's chart and allocate that check. So just remember that disconnect there. But you definitely want to allocate the check because you want to know if you got paid for that visit, right? The next one here is messages. These are all created for you. These happen based on things that happen in the system. And some of these have changed, I think, since I did the video last. So I'll just run through these again. When you mark the patient as canceled, or if they cancel their appointment, this goes out. But if you don't cancel the patient, they don't ever get the cancellation notice to prompt them to reschedule their appointment. And you can go in and look at these in your own system to see what they actually say. The other thing that won't happen is you don't get a task on your task list that reminds you to possibly charge the patient for their cancellation. So that's a process automation that we've created for you guys. The other one is missed. The system doesn't know if the patient didn't show up. You got to tell it. So always mark the appointment as missed if they didn't show up. Few things, right? You got to charge them if they missed, and you want them to get this email that says, sorry you had to miss, click here to reschedule. When you confirm the appointment or when you decline the appointment, they're going to get an automated email. They're going to get a reminder about their email or reminder about their appointment that's coming up and prompt them here to do the forms if they haven't already done them. The happy birthday email is going to go out just based on their birthday. The one thing to think here, this happened to us recently. My boyfriend had a patient that passed away, committed suicide actually, a younger guy. Mom had access to his emails and he happened to commit suicide very closely to the weekend of his birthday. And so when mom got into his email that next week, she saw happy birthday from our practice. She wasn't very happy about that. So you can only imagine, how that felt. But anytime a patient, you discharge a patient, terminate a patient from your practice, or something, they pass away or something happens, make sure that you're disabling their email from your system, removing that, make sure you make them inactive, and then they won't, make sure you cancel any appointments that they may have outstanding scheduled for them, so that those notifications don't go out. Just have a policy in place. So if you hire somebody or whatever, they understand that they need to do that too. They're going to get a reminder to join their patient portal about 4 days before their appointment. They can fill out their paperwork and everything inside of their patient portal. They can get all the papers you share with them or you send to them, whatever, in their patient portal, book appointments, kind of stuff. The next one is time to book again. So the system looks to see if appointment is coming up, and it looks to see when their last appointment was. So if they haven't had a follow-up appointment scheduled in 75 days, then the system triggers and they send this little email out, not a text, an email. This is how we haven't seen you in almost 3 months. Please click here to schedule an appointment with us. So it kind of helps you out in having to look through your patient list to see who hasn't scheduled with me. I need to call them or whatever. This is going to happen at 75 days. You can change the days that it goes out. We set it at 75 because we wanted to give patients enough time to get in to see you. Most providers sometimes are booked 2 weeks out. So you can always minimize this a little bit more and change your wording right here if you want to. Standard, that's kind of what we did to keep you from having to send those little bridge refills, before the patient can get in to see you again. And then the last one is a telehealth reminder. So this will change if you have Google Meets or if you're using IntakeQ's telehealth, it'll just say telehealth. Using Zoom, it's got Zoom here. So this is one of those little things that would have to be changed if you changed your telehealth platform. But they're going to get a reminder 1 hour out before their appointment. You can create another one of these if you want to for 30 minutes out, 15 minutes out. If you want, we just create the 60-minute one for you. And they get their link and everything goes out to them automatically. Now you'll see here that you have the ability to add some SMS text. And you'll see you can do scheduled ones, like you have scheduled emails, and you can do that time to book one as if you want to. We do not set those up because of the reason before about being too spammy and getting marked as junk. If you want to shut those up, you can. It's just not something we do on setup because it's just not a good idea to do that. Preview's not anything really. Your booking widget. So did anybody here set up their own website, or do we set up everybody's website? Okay, so on your website, there are some links that you should have on your website. We already talked about the Zoom link, so you should have that one there. This is the link for patients to book with you online. So you connect this to whatever booking button that you may have on your website. Just a little note here, side note. If any of you try to sign up with ZocDoc, number one, I don't recommend them. They're expensive and a little crazy, but they will take over your booking widget button because they want all the patients to book through them. So just know that they'll try to put their own book now button on your website. It looks a little weird. So just a side note. This will need to go there. And then in your patient portal, this link to sign into the patient portal needs to go there too. And if you're using Zoom, then your Zoom link. Okay. Go back to booking settings. In here, we went ahead and put your header in. So this is all flowing over. When the patient goes to book online, they're going to see your nice header with your logo and everything. This is where you would change that if you need to do that at any point. We're going to just go into the booking widget so that you can see what this looks like. When the patient books online with you, they're going to come to this page. If you want to change these buttons, you can send a little help ticket into intake queue and ask them to change the colors here. So Julia, you're blue. If you want a blue button here, you just have to send them the hex code. Does anybody know what hex codes are? The hex code is the color. Every single color on the wheel of colors, every little shade has a code. It's a hashtag and a bunch of numbers. There's actually a website that you can Google that says, what is my hex code, I think? And you can put a picture there and it'll tell you what the hex code is. You submit that hex code to intake queue and they will write a special code in the background. It doesn't cost you anything, but they'll write a little special code in the background that'll change these buttons, the color for you. Oh yeah. So when the patient comes in to book the appointment, they click book now. They're going to put in their basic information. Hang in there, guys. I told you this was the biggest part. Date of birth. And then this is where your screening questions pop in. They have to answer all these screening questions to get to the next screen where they put their credit card in. Then after that, it tells them their appointment is pending confirmation. They will not get their paperwork until you approve that appointment. Okay, so make yourself a note that every couple of days or at the end of your day, you're going in and checking to see if anybody's pending a confirmation. The way to check that is in your list area. That's the next area we're going to go into. So when you go to list and you come down to appointments, most of your stuff is going to be done in this list. The rest of them have their own little things, but a lot of stuff can be done in this one. When you click appointments, and you click status, pending confirmation, this is going to list out all those patients that are waiting for you to say yes or no. It's also going to list those patients that created themselves an extra chart. So if it's a follow-up, comes up in here as a follow-up, you're like, Mary, what did you do? She created another chart herself. So you'll have to merge those charts. And I know I went over merging charts in the other video. So that's that. The other thing is when it comes over into your calendar, the appointment's going to look like this. You can click on it and down here, not this, you'll see another one that's going to say custom fields. It's a little blue hyperlink. You click that and another little box is going to pop up with all the answers to the question. Once you read the questions and you agree or disagree with taking the patient, there'll be a big green button and a big red button here. The green is confirm or accept. I can't remember which terminology they use. You click that, paperwork goes. You don't have to do anything extra. If it's deny, the red, you have the automatic declination email that will go out, or you have the ability to put a little note in there too if you want to refer them somewhere else or whatever. That goes in. You can open your initial note from this screen. Don't open subsequent visits from here though, because you want to replicate those notes. And we're going to talk about replicating in a second, but you do have the ability here in the more button to create note. And she's already created a note, but it would be right here, say create note. Do it for the first visit, but not after, because if you create a note every time, then some of those fields aren't going to pull over and you're going to be doing on drop downs and click boxes again. All right, lists. Every single one of these lists have their own little filter things here. So you're going to go through and kind of play around with them. Some of them have column changes that you can change and, give this even more information here. But explore each one of these each one of these lists and see what they can do. You can export patients to Excel, and if you're an Excel guru, you can play around over there. but every single one of your patients will be here with some specific information. There are these little status fields that pop up in all the lists, and they're a little bit different. Things to note in this one, you can look to see if a patient has a portal in here by looking by their name and see if they have a portal. You can also check to see if patients are using duplicate email. This comes into play if you're seeing kids or husband, wife, whatever. They'll try to use the same email. And it's okay if they're never going to use the portal, but you may use the portal, right? So if you want to send that lab order sheet or that return to work thing, if someone's sharing the same email, the system doesn't know which portal to send that to. So they have to use separate emails. So you want to make sure that you're running this every once in a while, just to make sure that someone's not duplicating there. If you don't know it, you can add these certain little symbols after emails to have the same, if I'm saying this correctly. For example, my personal email is travelingbev72@gmail.com. I can go in and do traveling.bev72@gmail.com. It'll still come to my traveling bev one. I can do travelingbev72 plus sign. It'll still come to my Gmail, the regular one. So there's certain little characters you can add in variations of that initial email. So what I tell parents to do, make variations, right? It could be traveling Bev 72 plus John, plus Mary or whatever in there. It'll still get to me, but I won't have to go log into all those different emails. So the other thing with that too is you have kids that are minors, right, when they come see you, and now they're 18 and they may not want mom in their system anymore. You have to make sure they have those different emails. So check that. Intakes, this is a good one to see if patients have their intake forms here, but I'm going to show you an easier way. You can come in here exactly and look at the intake, and I do recommend that you do that. One, gives you a heads up on the patient, but two, you can make sure that they've done their paperwork correctly. Sometimes moms will come in here and fill out kids' information and actually put her stuff in, so the kids or wives will do it for husbands or vice versa. So just make sure the information looks correct. Also scroll down and make sure that they actually uploaded their pictures of their driver's license and their insurance card, because sometimes people get funny and put other stuff in here. Had it happen. My boyfriend's practice, somebody put a meme in that said, "What the heck is this?" And I thought, that's funny, but I still need your driver's license. So just make sure that they put their adequate stuff in here. You can reject these forms. So if they didn't do something right, you can reject it and send it back to them, and also put notes in. So play with that when you're testing your patients. The rest of them, you won't need any of these except for if Crystal hadn't already done this form, you do have the ability to complete the form for the patient. So remember, we talked about that guy that doesn't have a credit card because he just got out of prison. He's done all of his other paperwork. You've come in here and you've checked everything. He's done everything except for that one little consent form up here at the top for credit card. You can mark his packet complete. And when these are done, they get a little check mark. But you'll be able to complete his packet. Now it sends all that information to your note template. Okay. Don't print forms out. Okay. If they can't fill out the stuff electronically, then you probably need to refer them somewhere that they don't have to. Because your system is so heavily electronic, if they don't fill out the paperwork and they print it all out, first of all, when they print this intake form out, as many questions that are in there that are hidden and stuff like that, the intake form is going to be 75,000 pages long. Joking, but long, right? They're going to have a book that they're going to have to fill out. And then somebody is going to scan all that back into your system. And then guess what? Your notes aren't complete because that information don't talk when you scan it in. So if you have someone that doesn't have a computer at home or a smartphone, there's options, right? Can you go to a neighbor's house? Can you go to a friend's, the library? Could you come into my office sooner and I'll give you a tablet to do this stuff on, but don't give them the option to just print it because it's just not going to be a fun time for any of you. So that's enough on printing. You see patients' tags associated here. You can also see if they've ever even seen the form. So if you're calling somebody to shake them down about their paperwork and you come and you check and you know for sure they didn't do it, because sometimes people will do it and they forget to hit the submit button, right? You can just complete it for them if they've done it without calling them. But if they haven't, you need to get them to do their paperwork. You want to verify that their email's correct, right? And go, hey, Crystal, you got it on the 3rd. I don't know if you didn't realize what that was, but that's what I need you to complete. I'm going to resend it to you. And you do have the ability to resend it. I'm not giving me that option because she's already completed it, but it would be right here. Resend that form. You can also filter out through the different forms here, all the different forms, dates, specific clients, they've completed, not completed, whatever the deal is. This will give you a lot of information there. Notes, the only thing I'll say here is this does not tell you if notes are missing. It only tells you if you have a note that has been completed or not completed as far as you've opened it. You just haven't locked it. It's still unlocked. It's not going to show you anything missing. Okay, so don't rely on this to close all of your notes. Go to the next list. That's the appointments one. This one you can search specifically for missed notes, missing notes. So I'm going to put all patients in here. So it'll show right here, this patient has a note on it already. If it wasn't a note, there would be an orange, this would be orange. If it's upcoming, it says upcoming in gray. So at the end of your day, you would come here to make sure that you've done your notes on all your patients or whenever you chart. Okay. You can create your invoices from here too. So all of this can be done in the one fell swoop. The other thing, my front office people use this to communicate with each other for those patients that haven't got their paperwork done. So if Crystal hadn't got her paperwork done, I can go in and check it, make sure. If she's got it done, I'll see a little check mark here. If I don't see a check mark, it's an exclamation point. I want to make sure she just didn't submit, not hit the submit button. But if she didn't, I need to cancel her or whatever. But if I'm the first person looking to see if the paperwork's done and it's been done, I can put a tag on the patient's chart. And that tag is intake completed. If it hasn't, you'd put intake needed, right? So I'm going to show you how that makes it easy for you to see over here. Now it's very easy for me to go through and see who still needs their paperwork because your intake needed is orange. So who do I need to shake down or cancel or whatever? These tags are all populating because of what happened in your intake form. So when they said they had an allergy or they found you through ALMA or they don't want you talking to their therapist or they don't want you to bill their insurance or they aren't using their insurance, they don't have insurance, that's what's populating these tags for you. You didn't have to do anything. But you also have the ability to add tags on individually. I do caution about having 50 million tags in here. Have somebody just control the tags somehow where everybody's just not adding tags in because it makes this filter thing very diluted if you have tags that mean the same thing in here. So just kind of keep that clean, go through it every once in a while, clean it up so that you can filter from tags. So for example, if you want to come in here and find out, I want to filter this list out by just my ALMA patients, come in and click ALMA and it's only going to show ALMA patients with that filter, that tag on it. So filters can be very powerful if you use them correctly. The status here, we talked about pending confirmation. If you're doing your no-shows and cancellation things, you can come here and just pull up the canceled patients, just pull up the missed patient. You can also look for those that were confirmed or not confirmed. So this one filters out a bunch of different things. But I do like this view a lot. It gives me just a lot of information very quickly here, kind of as a dashboard. Invoices is going to tell you where people owe you money. This also tells you if you are taking insurance, who overpaid you or who underpaid you based on a claim that was filed. So you all should be charging up front for your copays and your co-insurances. Charge people something because something is better than nothing. Insurance verification of benefits is never black and white ever. It's always kind of gray. Sometimes it'll say it's a $20 copay, it's being a $20 insurance, or once the claim pays, it'll say no patient responsibility, and you've never known that. You charged them 20 bucks, whatever. Now you got to give them the 20 bucks back. That's where this is going to play in for you and make your life easier. So when you click this, overpaid, it's going to tell you if someone paid you too much money and you need to refund their charge or give them some of their money back. The opposite is if they didn't pay you enough. Very easy to see that go in, hit the card for the rest of the amount. So pay attention to these at least once a week, every 2 weeks, because you could be leaving money on the table. The other option that IntakeQ leaves you is to put a credit on the patient's account. I don't recommend putting a credit on the patient's account because that patient may never come see you again. And then at the end of the year, you have to give all these people their money back, and your credit card processor will only allow you to refund credit cards after so much of time. And they're going to shut off the ability to do that. Then you got to figure out how to get these people their money, whether it's a snail mail check or whatever. So keep your bookkeeping clean there with the refunds. I don't care if they're going to come see you next week and they're probably going to have to pay you another copay or whatever. Just charge it at the time of visit. It'll make things much cleaner. Claims, if you're taking insurances and we set up your insurance claims, you can see things in all different ways. I recommend the appointment screen because to me, I can see this easier. I understand what this means. You can see if your note's been done, so can your biller. So if you've got somebody billing for you, they'll know if this note's been done and they can go ahead and submit your claim. Stay on top of this because every single one of your insurance contracts are going to have dates that you have to submit claims after you see the patient. If you stay on top of it, you won't have any problems getting paid. But if you get behind and now you're 3 months in and you're running at that 90-day mark because your insurance says you have 90 days and you are at 91 days before that gets sent in, you are not going to get paid. They don't care if your house burnt down, your grandma died. They don't care. You're not going to get paid. So check all of your contracts and make sure that you know what your dates are because they are all different. Okay, they used to go 6 months out. Those keep getting shorter and shorter. The shortest one I've seen is Blue Cross Blue Shield of Arizona. I think they're at a 30-day. You also have another date range that you need to pay attention to, and that is if your claim gets rejected for some reason or denied for some reason. And guys, insurance companies will decline claims for the stupidest stuff, like wrong taxonomy code. Like, what do you mean? I haven't changed it. What? And you wait on hold for an hour, and then they say, oh, our bad, resubmit the claim, right? If you think about the grand scheme of things, how many claims are coming into an insurance company in a day? And if they kick back even 10% of those claims, how much money is that insurance company potentially getting if you don't paying attention and resubmitting those claims? So make sure you are paying attention. Even if you hire a biller, you should still be paying attention to what's happening to your money, okay? And on that same note, don't let billers take your information and put it in a different system. They have to bill inside your intake queue or they don't bill for you, okay? Because it's not transparent. You will not know what's happening with your money if they take it and put it in a different system. And I've personally talked to at least 5 providers that have lost tens of thousands, not just thousands or hundreds, tens of thousands of dollars because they weren't paying attention to what was happening in their claims process. Okay, so just a little note, food for thought there. Across here, as the claim happens, you're going to see like what you billed out in the claim page. You can go into the EOB from here. If the patient had paid something, you'll see that amount here. When the insurance pays, you'll get a little check mark and it'll say paid beside it. So this tells you a lot of information. Now, this magic of this communication right here doesn't happen unless you create your ERAs in your clearinghouse. And we can't do that on our side and the EHR side. It has to be done once you get credentialed with the insurance company. And it has to happen with every single insurance company. And it takes about 45 days for it to work. So there'll be a little gap there of you'll have to go into the clearinghouse to see if something paid and then allocate it over here before that comes through. And if you have problems, don't know how to do that, we do have billers that can help you with that kind of stuff. Even if you don't use the full system of billers, we have like billers that you can just pick their brain for an hour for DIY billing. But you have to set those up. Otherwise, you never see the communication happen. So the ERAs are the communication that goes from your EHR to the clearinghouse, Office Ally TriZetto, to the insurance companies. That part of communication is set up. It's the other side that comes from the insurance company to the clearinghouse back into your EHR that you have to do on that backside with your clearinghouse. TriZetto makes it a little easier than Office Ally, but either way, you still have to do them. The other thing is your EFTs, electronics funds transfers, the magic money, when they say they're going to pay, that just goes into your bank account. If you don't set that up, then they're going to be sending you snail mail checks. And nobody likes snail mail checks in 2024. Okay, you still will get some. There's no way to get completely away from them. All of those little secondary insurance companies are going to send you the $3.68 or whatever, but your big payments, you just want it to go into your bank. So you have to set those things up. Okay, moving on from this one. Recurring payments, not going to go through that. That's if you have payment plans, you can see them all here. If you have to send your notes out for signature requests, you can see who still needs to sign your notes. If you have shared documents with patients or third parties, you can see all of them here, like they've been read or whatever. You can also see these inside the patient's charts. Reports, the only thing I'm going to go over in reports is your income. You can see if you got multiple providers, even yourself, you can run a report here and see what you made for the month. You can drill down into each one of these to see what makes up these payments. So if you're like, what refunds? What refunds? You can click here and see those. And you can do this on every single provider in the house. Excuse me. Your aging revenue, this is where I said it's important for you to pay attention to your money. Even if you have a biller, it's important for you to pay attention to your money. So as you come across here, you're going to have your different payers are going to pop in, Cigna, Aetna, Blue Cross Blue Shield, whatever. They're going to pop in here. You're going to be able to see who owes you money, who hasn't been paying, okay? This first bucket you don't care about. These are patients that the claim has just been sent in and we're waiting on them to pay. The second one here, why aren't they paying? What's going on? What's happening here? Has there been a claim process? Like, did it get kicked back? What happened? You should be getting paid, wondering. You can drill in and see what the claims are that make up this amount here. This one, what really is happening, because I'm fixing to not get paid. Fixing, that's a Texas term, y'all. So 90 days. Like, what's happening here? These should be either in appeal status or something. Somebody's calling. What's happening here? Checking in the clearinghouse. Was it just didn't connect? What happened here? So that you don't lose money. Here, you've lost the money if it's not in that appeal status or maybe that secondary claim that you're pending on. Okay. So pay attention to these buckets so that you don't lose money. I go over a lot of this in the training video. So if you have not, a lot of you providers will wait until you start seeing patients before you turn on your e-prescribe, and that's totally cool to do that. That's going to be here though if you have not enabled that. So Julia has already done that. That is all taken care of in here, but if you have not done that, you have to do it or you won't be able to e-prescribe. That is not something I can do for you because you have to go through ID.me, do all this validation stuff, all of that. There are lots of help articles as well in the support area here that tell you how to do that through those steps and also how to e-prescribe. I'm not a provider, so I can't show you how to e-prescribe in here. That's something I have to rely on the support articles to show you how to do that. So that is your e-prescribe. There are also some questions that have to be set up here, and I think Crystal sends those out on the extra questions that have to be set up in the background that have to be done once you implement e-prescribe. Those question types aren't even available for us to set up for you until you enable your e-prescribe. So that is setting up your pharmacy. Right now we have the pharmacy in the demographic area for your intake form, and it could stay there. That's fine, but it's not going to talk to your e-prescribe. Okay, so you want to enable that pharmacy question once your e-prescribe gets set up so that it talks to the e-prescribe area and pharmacy's already in there. The other one is a medications question, and you'll see this talked about in the IntakeQ community. And again, we go back to the whole clinical thing. IntakeQ brought this question in. It says, oh, we can pull the patient's previous medical history or medication history, and we can put it in the note after the initial visit. You can't do it in the intake form because that patient does not exist in your e-prescribe. So we can't put it there. We can't put it in for that new patient evaluation. It's going to the circle of death is going to happen. It's never going to pull anything because again, the patient doesn't exist in your e-prescribe. We can pull it in though on your follow-up. And what will happen though is it'll pop up underneath that grid of where it says current medications, I think is what it's called. It'll pull up underneath there. There is a caveat to that question. And that's the reason why we left the grid in. It's because if the patient pays cash for any medications, it does not go into that big database in the sky of all the medications that they're on. You will not see it in that medication history that automates if they're paying cash. You also will not see it if that patient is using some little podunk pharmacy, because that pharmacy may not participate with that database either. That database is filled with big pharmacy information and also with health insurance information. So just keep that in mind when it's not a catch-all. Don't do away with that grid because you want the ability for patients to self-report everything that they're taking. So that's e-prescribe. Fax. So we can't take this button away, guys. You can still fax you have to go and get an SR fax account, and they charge you by the page, and it's just really not something if you're using Spruce that you need. I implemented my boyfriend's practice because I wanted my own private little fax that I want to go in and zip in, fax some stuff out real quick and be done. It wasn't something that we're getting all the faxes to. It does make it easier, but it is an extra cost. And when you're first starting, if you're already doing Spruce, there's no sense in having the duplicate there. But as you get busier, you're like, $12 isn't that big of a deal. I'll go ahead and implement the fax over here and I can send out stuff. But just know that that's where it starts is $12. And they charge you for incoming and outgoing faxes. So that can get quite expensive if you're doing this versus having like Spruce or some other system that you're already paying for. So it's just kind of an overlap. Processes. I think we only have 2 more things to go here and we'll go through your notes very quickly. So processes, these are the things that are happening automatically based on triggers inside the system, right? So when we talked about that task list earlier, this is where these come from. And you want to check your task list every day to see if you have tasks there. You can also put your own tasks over there, but these are things that automatically happen. If you mark the patient as missed or canceled, or if the patient cancels, then you're going to get that little reminder to trigger you to say that you need to charge them or not. If the patient says they don't have insurance or they do not want to use their insurance, they have to have a good faith estimate. Does anybody not know what a good faith estimate is? Okay, so it is so the government came up with the No Surprises Act a couple of years ago, and they said that no patient should be surprised with their billing, but they didn't think it all the way through. So With mental health, you don't always know what the patient's diagnosis code is, right? Before you see them. But in the bill, it says you have to provide them with a diagnosis code. So in this GFE, we've just put the standard F99, other mental health disorder, otherwise specified or something like that, just kind of generic catch-all. But you have to tell the patient an average of what all of their appointments for the year is going to cost, and pad it a little bit, right? Because patients get into crisis and stuff like that. The reason why I say pad it is because you're held to a $400 window. You can't go over $400, or if the patient gets mad with you and decides to launch a complaint to CMS, or I think it's Department of Health and Human Services too, for $25, they can have those people all up in your business. And I don't know about you, but I don't want those people in my business. So you have to give them that good faith estimate that says, hey, Mary, it's going to cost you $15,000, I don't know, number pulled out, for the whole year of your treatment. If you go over that, if the patient's in crisis and now you're seeing them every week, you're going to have to send them another good faith estimate because you need to update them. And you have to send this out yearly. So at the beginning of the year, you're going to use a little filter because it's going to pull all the patients with the GFE that automatically tagged for you so that you can send them one. IntakeQ has a GFE in here, but it is not complete. And I've told them that, but it's still out there. You have one that we gave you that has all the CMS requirements on it. So this is just tagging you and said, hey, you need to send this for the patient. You have to send it before you see them. So that has to be a process that you're checking and sending those good faith estimates out. The patient does not have to sign it. The requirements are just that you send it, and it shows in your system that you send it to the patient. So you can, when you're playing with your system, go in and play with that, and it'll make more sense to you. Lab results. So when you send that note template, whether you send it to the patient portal or you print it out, you close the note, you sign it and lock it, close the note, it will put something on your task list that says you got labs pending on this patient. And if it's just you and you're wearing all the hats, it's going to come to you. But if at some point you have a front office person, you can't have that task go to that front office person, so they're watching for the labs. Julia takes Medicare, so it's going to trigger her. Medicare as a secondary payer form is a questionnaire. You cannot hook questionnaires to questionnaires. So that's why it's separate. So when that patient says they have Medicare, then Julia is going to come in and send this to the patient. It's going to remind her to send it to make sure that Medicare is actually their secondary payer and not their primary. Because people always want to use Medicare as their primary. They don't have that choice if they have other options. So this is what asks them those questions. Then if the patient checks on their intake form that they're feeling suicidal, that they're feeling violent, it's going to notify you. You might want to know that if the patient's coming into your office, if they're feeling violent or not. You just check it off like, yes, I know. There, you might want to reach out to the patient if they're feeling suicidal and say, hey, go get help. It does tell them, like when they check that box, if they're feeling suicidal in their intake form, a big red thing pops up and says, if you're feeling suicidal, call 911 or go to the hospital. But you might just want to touch base with them if you want to. And then the super bill pops in just to kind of remind you to do the patient's super bill or do the patient's chart so that you can put the diagnosis code and the CPT code on there, because you have to have those two components to generate a super bill. And a super bill is what the patient would send to their insurance company. They're out of network to try to get their money back. Okay. So that's what these are. These will all trigger automatically. Now you're going to start thinking about, as you're working through your processes and stuff, if you think of something that you're repetitively doing all the time, question if maybe there might be a process in here that we can make things easier. So if a box is checked somewhere, potentially we could make something else happen that takes away that manual process for you. This is just a start. Payment dashboard. So with your payment dashboard, you can refund payments in here. Don't do it here. Do it from inside the patient's chart in their invoice where you charge them that amount. Because in the invoice, you can refund it and it's going to log it there and it'll show it in the patient's statement. If you do it here, it doesn't talk back to the invoice. It just sends the patient back the amount. So make sure you're always refunding inside the invoice and not your payment processor. You can go in here and see what all processed and if there's any issues or anything, but just make sure that you don't refund from here. Your request feature, this is where you can go to chime in with other people that have put in any kind of requests for things, and there's a bunch. I mean, there's 118 things that people would like to see in invoicing. And you'll see stuff like in process. Right now, they're working on doing an AI charting assistant. That's pretty cool. You can upvote it if that's something that you would like to see. You can also see the conversation that's been happening around that. So come in here on all your free time and see if there's anything that you would like to upvote. The more people that vote on it, the chances are they'll move it up in their list to try to do it. And then support, this is going to be big for you when you're first starting out. If you come in here and go, what did Bev say? How do I chart a missed appointment? You can come in here and start typing stuff in. Their help articles are very cool. They're short and sweet and pretty easy to read on how. This is going to be your first line of defense if you don't know how to do something. If you still can't find your answer here, then the IntakeQ community on Facebook would be your second. You can also email IntakeQ here on contact. If it's something with us, you can email us or put a support ticket in with us as well. So those are all your little avenues. So the day comes to do your notes. I know we're running a little bit over here. The day comes to see the patient, and you need to do a note, or you're going to try to find a chart to do a note. If you're just looking for the chart, you can come here and search the patient's name. If you're coming in for the visit, you just click the visit, and you click the patient's name here. Brings you to their chart. So I know I went over all the things in the patient's chart over here, and I went through most of these things here in the other video. There's a few things I'm going to hit on. One is your notes, and then we're going to cover your overview sheet here and a couple of other things, and we're done. When you get ready to see the patient, number one thing, did their intake form get done? Okay, it should never get to you without a check mark. If it's got anything other than a check mark, potentially your note's not going to be done. What I recommend to do, if that happens, right, you go in and look at it, especially if it's just you, go in and look at it and see if they filled it out. If they filled it out, you can just submit it and then the stuff comes over. If they didn't do it, then you have to make a decision there. You're going to go ahead and keep the visit, or are you going to cancel them and have them fill it out and then, you know, reschedule them, or are you going to go ahead and see the patient and hope that they're going to do the intake form and sign all their consent after you see them? So you have options there. If it's checked though, click the little plus sign and create new note. This is the only time you're going to create this note, unless you want to pull a brand new note in. After this, we are going to replicate the note. That is making a duplicate copy of the previous note that you just did. All of your other notes are in here though that you can pull in and do. So we're going to go to your first one. We're going to act like there's not one already over here. So we're going to pull the first one in. All this information is going to come from this intake form. You got to stop here and tell the system which type of appointment. Is it a new eval or a follow-up? This tells the form what questions to show you. Okay. If you do the initial eval, everything's going to be cascaded out like the patient answered it in the intake. If you do follow-up, then you're going to see little questions like this. Has there been any changes since the last visit? No, you just keep moving. If you say yes, it pops it open where you can document those changes. So no, and then your third visit's even easier because you've replicated this visit with all the no's, right? You just copy it. Anything changed? Scroll through, yes, few little changes, done, sign the note. Caution here, big red caution flag. It makes it real easy to duplicate the last note and not change anything in this note, okay? Then the next note comes along and you replicate that one and you don't change anything in it. What do you think that's going to do with an insurance auditor? Big red flags. So make sure that you were making your changes in here and not just scrolling through, signing it and done because nothing changed, okay? Make sure that you were changing something in the chief complaint here, in the HPI here. You'll have the last one, like you know what it is, just make a different version of it, right? Or change something in there. And then your assessment, treatment, and plan at the very bottom. Those things at minimal need to be changed. Okay. Don't even open up the note unless you're ready to start documenting because you won't know, right? You've pulled all that stuff in from the previous visit. Unless you go look at the previous visit note and see, did I change something over here? Just wait until you're ready to document on the note, go through it all, sign it, and be done. Okay. It's a pro and a con of doing it this way. So we're going to scroll back up to the initial eval here. If you have telehealth, you have telehealth questions. Now this form is going to feel very drop-down heavy and very click box heavy in the beginning. So very first note, it is going to be heavy because you're getting all this information, right? But when you replicate the note to the next visit, all these little drop-down boxes and click boxes will already be checked for you. So the only thing you will have to do is edit it if it's something changed. So it's going to make it easier for you for the second, third, and so forth notes. If you come up here and you check the little checkbox again to create a new note, all of those little boxes aren't going to be filled in for you, and then you're going to feel like you're in click box and check box hell, okay, because you're going to have to do it all over again, okay? So just make sure you replicate the note. This stuff is coming over directly from what the patient put in your intake. So you can have spelling issues, grammar issues, whatever. You can correct it here if you want to, or you can put it in quotes, whatever you want to do there. Any of the boxes you see the little snippet, the little lightning bolt looking thing, that's where all your snippets live that we put in here for you. We put about 60-ish ones in here. Obviously, this wouldn't be applicable to a chief complaint, but you get the idea. It's just throwing big blocks of text in there, and you can edit those texts if you need to do that. You also have the ability to add in text boxes. So if it's something's just not there, my gosh, don't freak out because you're like, I have something I need to document here. You can add a text box in. Okay. You can also add attachments to stuff. So if somebody brings you records, there's a place for that later, but you have a letter or whatever you might want to put in this note, you can add that attachment. Again, play with these as you're going through and playing with your notes. So this is new, this little collapsing the whole section. You see how it collapsed it there? As you're moving through, when you get done, if you just make a habit of collapsing these as you move through the system, if you have to scroll back through up to get to something, it's going to make your scrolling a lot less. If you leave these expanded, then you got to scroll up to the top again. They don't make it easy just to go to the top. So just keep that in mind. It doesn't stick out real bright there. So that's how you collapse these little areas if you're moving through. All this stuff is coming from your intake. You're not filling any of this out until you get to, I mean, you're reviewing it with the patient, right? But until you get down to here. Did you do a Columbia? If you didn't, you just didn't perform it. Keep going. If you do need to do one, was performed, and now it puts the Columbia in for you. You didn't do it or they refused, you have those options. Just keep scrolling. All this again was put in by the patient. You have all these comment box or free texting thing you may want to put in. Keep on going. Just review till you get to here. So this is answered on the intake. However, we know patients lie about this sometimes on intakes, even their substance use stuff, but this has a CAGE score attached to it. So this patient said yes on their intake, and so they have she probably didn't do the CAGE screening because she was playing with your system, but the patient would be prompted to do this CAGE screening here, and you would have that already, it would already be answered. So, but coming across here, if they had said no, that wouldn't be there because this would have been no. If they said no, you don't see that, right? But now you're talking to the patient, you realize they're a full-fledged alcoholic, you need to put the information in here. You click yes, they do drink. You're able to put in their days and amounts and all that kind of stuff, and then you have the option to put the CAGE screening in. So if you did one, you can click yes, and you put your answers in. The problem with putting these screening tools in your note template is that IntakeQ is a one-to-one connection on forms. So it doesn't know to go and pull the individual CAGE screening scores in. It's only looking at this form. So anytime you come into your notes to document any of these screening questions, just remember there's going to be previous answers there. You'll have to change those. Right? So if you didn't do it, it's not going to show up in your notes. But if you did do it, it's going to show the previous answers. Does that make sense? It's going to do the same thing with your PHQ-9 and your GAD-7 and those screening tools at the bottom because it's looking at this form. If you send an individual GAD-7 or CAGE, here, oh, that's not the one I wanted. Here, it does not know to go and pull it from here. It doesn't have the capability of doing that. It's only pulling it from here. Does that make sense? All right, so scrolling on down, you're still just reviewing. All came up from the patient's chart. Female reproductive history. This is your box. Did you provide any pregnancy education? If they have a uterus, you better be prescribing doing something. Documenting something. Either you did or you didn't, but you should be giving them some kind of education if they get pregnant. That is a multiple select box. So you can, Judy popped out, you can put multiple things in there, but you cannot text in here. It looks like you can, but you can't. Okay, so if you are trying to text that stuff and you go down to the next, see how that goes away? Not there. That's where you would use your add new text box and add in a pregnancy education container. Done that a few times, right? But you could also use your snippet. We put 2 things in here for snippets. Pregnancy 1, pregnancy 2. You can add on, you can take away. So that's adding that box on the fly and also having that education there. Now the next visit, You come in and you're like, Bev, this is from last time. I don't want it in this next visit because you replicated that note, remember? Maybe you didn't give them any education this time. So you would X out the stuff that you didn't do and you want to get rid of this box. You click X and click delete. It's gone. That was really easy, right? To take it away. It don't come back. Okay, you can't say, oh, oops, it's gone. So don't do that with these other things that are hard coded or built into your form, because the only way to get that box back is to open up a whole new note, and then you back in checkbox and drop down hell, right? Because you got to do all those things again. You didn't replicate it, you had to create a new one. Hopefully that makes sense. Scrolling on down again, patients put all this stuff in, all their medical surgical history. You do have the ability to change anything in here. So the patient says, oh, I forgot to tell you, I got dementia. Bad excuse or bad example, but you get the idea. Your medical review of systems is here. So again, the drop down, they deny everything in that system. They denied everything. If you didn't assess it, you just say you didn't assess it, right? Not assessed. Maybe they're positive for an earache. That's how you go through your whole review of systems. Now, when this replicates to the next note, this is already going to be here. So you would have to check again. If you, hey, how's that earache? And it's gone now, then you just say they deny anything. So you change those out. Your vital signs, first vital sign visit is here. Second one, you replicate the note. The second one goes here, the third, so forth and so on. This is going to get long after a while, right? And there's no way to just X the whole line out. You have to just take the data out. So if I do that, and I can click remove unused rows. In intake queue, currently there's no way to trend vital signs. So this is the best way to do that, right? It's keeping it front and center. Every single note that goes up, down, I can see what's happening with my patient's vital signs here. And COVID is gone, y'all. So if you're doing telehealth, you better get some kind of vital signs. It's a requirement on your chart to have some kind of vital sign. A lot of people have smartwatches that can get you a heart rate. They have phones. They have apps that they can put their little finger on the back of their phone and get a heart rate. They can do their weight, that kind of thing. If they are on something you need to monitor their blood pressure, then recommend them get a wrist. We all know that wrists don't work very well, but at least you have some kind of vital sign. I've also seen providers have patients take a picture at Walgreens or whatever of the little community one that people can go and get their blood pressure done. So make sure you're collecting those. Your psych review system is the same thing as your medical review systems. It's drop downs. And these are Carlette's words, not mine. So if they report periods of, that's how you chart that. Denies any of that and just move on through. Again, going to replicate to your next note. Your medical reviews, or sorry, your mental status exam or checkbox is going to replicate to that next note. Oh, and checkboxes don't print out on your notes. If you ever try to print this, no one's going to see the stuff you didn't check. They're only going to see the things you did check. Screening assessments, same thing as the cage. So this is how you document these. If it's the initial eval for an adult, you check this box. It's going to pop in your PHQ-9 and GAD-7. If it's for a child, it changes to the child ones, PHQ-9, GAD, YMRS for kids. Toggles those in. If it's a follow-up, it goes away, right? Because it's no longer applicable. It's not, you don't want it to pull from here, but you can still document that you did it, right? So on my initial, I would come in and start my history. That's a 4 out of 27 and an 18 out of 21. So 4 out of 27, 18 out of 21. I'm just not going to type all those in, but you get the idea, the dates that you watched, you looked at them, because this will be helpful for you when now you come to the next visit, and if you did review something, you can come over and go, yeah, they did another cage, their score was whatever for their cage. Now keep replicating, right? You can see when the last time you did a GAD-7 was, if it's gotten better, if it's gotten worse, without having to click into each one of those screening tools over here. You've kept them in your screening assessment history. If you didn't look at any, you didn't review anything, then you said, no, I didn't review them on my follow-up note. But it still stays here so that you know what the previous ones were. Does that make sense? Is that confusing for anybody? I know y'all are just like, shut up already, I'm done. I'm over this. Your diagnosis code. So in the other video, it told you to come here. You can still come here, but you can also add them here. Add new diagnosis. You can come in and pick several. Whatever those are, click done selecting down here, now it puts them all in. Maybe this one needs to be primary, you can move it up. Next visit, maybe it's secondary, you can move it down. These will keep following over as you're replicating those notes until you end the diagnosis code. And I know I showed that in the other video. So these will still be there. You don't have to keep adding them in. So if I have bipolar here, on the next visit, you don't have to put bipolar in unless something's changed somewhere, right? End the other one, start the new one. Because if you do keep adding them, then you're going to have bipolar 7,500 times a year. And your biller's not going to be very happy about that. So only new diagnoses added. Old ones stay here unless you end them. Now, this is something that gets providers a little confused, and we're actually in the process of changing these, but it's not there yet. If you want to change it, I can tell you how to do it. It's not hard. We can have a different discussion on that. But you saw current medications up top, right? That up top one is patient-reported current medications. Patient said that they take these. That's your med rec, for a better word, right? You're reviewing that every time you see the patient. Are you still taking your blood pressure medicine, your thyroid medicine? You're still taking the boost bar that I prescribed you? All those things? Yes. Down here is what you are currently prescribing the patient. They cannot talk to each other because the fields are different. This doesn't make sense to the patient. Right? If I put this grid in your intake form, it doesn't make sense to the patient. I had to ask them, like, what are they taking currently? This is for you. I refilled it on this date, and it's a start or stop, a refill or whatever here. So that gets a little confusing sometimes. This is getting renamed to prescribed by this provider, I think is what we said. And the other one is getting called medication reconciliation. But remember, those two forms are talking to each other, right? Your intake form and your note template. So anything you change has to be exactly the same. So if you choose to name that one up here, medication reconciliation, you got to copy that and go change it in your note template main form too. Okay. And if you get confused, let me know. I'll do a quick video and show you how to do that. The rest of these are insurance questions, y'all. It's a lot. Okay. It's a lot. But I did insurance audits when I was building these tools. So just keep that in mind if when you're scrolling through and hating life and hating me, that these didn't come from me.
Yeah, 5.
I'll check into that because everybody else got the meeting link at the right time. I'm not sure what happened there. I'll check into it. Look, if you want to join another group session,
I
you
would
can
like
definitely
that.
do that. It's up to you. Like, you're going to get the exact same training I did today. So some people are like, yeah, I don't want to listen to the whole thing again. You just send me the recording and I'll watch it on my own. You could definitely do that too. It's completely up to you. Either way you want to do that. So I'll send this out to everybody. You can view it if you want to. If you're saying I'm not going to watch it, I just want to do the live one. I don't go through a lot of questions and answers throughout the session. It's just me rambling on for an hour and a half, 2 hours almost. So make sure you've watched those 2 previous videos that you were sent and then watch this one. And then if you still feel like you need the 15 minutes, let me know. Or if you want to jump on another 90 minutes, do that too.
Okay,
Okay,
thanks.
You're very welcome. All right, guys. There's nothing else.
Quick question.
Go ahead.
So when I had my first initial meeting with you, I had mentioned that I wanted you guys to do my billing. So I wanted to set up another, I guess, a consultation, and they're asking me to pay $150. Do I need
you
to
don't pay
pay
$150
again?
for the billing.
Okay,
no,
so
you don't have to pay for a billing consultation. Send me an email. Send me an email to the Beverly at silverleafpms.com. And I'll send you the link directly to book. Or you can actually even go to our website too. If you'll go to silverleafpms.com and go hit the services and then hit billing, then when you scroll down, there's 2 options there. There's one for DIY billing. Like if you want to do your own stuff and you want a biller to help you, like walk you through steps for an hour, right? They can teach you stuff in an hour and you're doing your own thing. That is chargeable, okay? Because the biller's taking his time to teach you how to bill. The other one, if you're wanting us to bill for you, is above that. And that is a consultation with our billing team. And you'll talk to Brittany and she'll get you set up for billing and assign you a biller and all of that. Does that make sense?
Yes, that's what I'm looking.
You might have just clicked on the wrong one if that's where you went.
It sounds like I did.
Yeah.
All right. Thank you. Thank you.
Anybody else? Jenny, you good? Judy?
Good. Okay.
Okay. Go forth, play with the system. Test patients. Mickey Mouse, Donald Duck, test 1, test 2, whatever you want to call them. Go in and play with it, and you can delete them all later. But also while you're testing, make sure you're testing in order of how it would happen, right? Because if you go in and you pull the note in, and now you go over and try to do the intake form, the note's not going to work because you never did the intake form, right? So just make sure that you're stepping through it in the normal progression of how you would normally see a patient. Okay? Test all the little buttons, the hyperlinks, and the email messages. Test all that stuff. Touch everything. Okay? And then you'll feel more confident with everything. And just let us know if you have any questions. Okay?
Thank you so much.
Y'all. You're very welcome. Y'all have a good evening.
Thank you.
Take care.
Do you know when we'll get the